Let's go ahead and get started. Good afternoon, everyone, and welcome to today's webinar. I'm Donna Rice, the Chief Operations Officer for Diabetes Sisters. Diabetes Sisters is a dedicated community providing support, education, and advocacy for women living with diabetes and also for those at risk. We offer a variety of resources, including monthly virtual peer support groups where women can connect, share experience, and find encouragement in managing their health. We are thrilled to bring you this important discussion on the role of advocacy in women's health, particularly in obesity care. I want to extend a special thank you to Eli Lilly, our sponsor for Diabetes Sisters Weight Management Program. This webinar is the first in the series. What a better way to begin than by understanding the current state of obesity care in the United States and the ongoing advocacy efforts to improve it. Women's health has historically been unrepresented in research, policy, and healthcare priorities. Yet we know that when women advocate for their health, they drive real change, not only for themselves, but also for their families and communities. So whether fighting for better access to care, addressing health disparities, or ensuring that women's voices are heard in medical decision-making, advocacy is a powerful force for shaping the future of healthcare, and Diabetes Sisters is committed to advancing care for women. That is why we're honored to highlight the work of the Alliance for Women's Health and Prevention, a national organization dedicated to advancing policies that support and protect women's health across the lifespan. Today's discussion will explore why advocacy for women's health, especially obesity care, is more important than ever, and how each of us can be part of this movement for change. To lead this discussion, I'm honored to introduce Millicent Gorham, the inaugural CEO of the Alliance for Women's Health and Prevention. Millicent is a trailblazer in health advocacy, dedicating her career to advancing health equity and improving access to care for underserved communities. She previously served as the longtime executive director of the Black Nurses Association, representing over 300,000 African American nurses. She led Movement is Life, a nonprofit focused on reducing health disparities through mobility and physical activity. With over 35 years of experience in government relations, Millicent has advanced policymakers, served on influential health boards, and shaped national conversations on healthcare access, equity, and prevention. Her dedication has earned her numerous awards, including the National Black Nurses Association's Lifetime Achievement Award and recognition from the American Academy of Nursing. Joining Millicent today is Shenese Colwell. She is the founder of LAB, Life After Bariatrics, Work and Fitness. Shenese is a passionate advocate for post-bariatric patient success, working as a certified fitness and bariatric lifestyle coach. She helps individuals navigate the emotional and physical aspects of weight loss surgery, ensuring long-time success, having maintained her own 115-pound weight loss for over 7 years. She is a dedicated mentor, speaker, and leader in obesity and fitness community. We're excited to dive into today's conversation and hear their insights. So please place your questions in the Q&A box, and I will address them with our speakers at the end. So now let's get started. So please join me in welcoming Millicent Gorham and Shenese Colwell.
Good afternoon, everyone. I am the marvelous, magnificent, magnanimous Millicent Gorham, and as Donna mentioned, I am the inaugural CEO of the Alliance for Women's Health and Prevention, or AWHP. AWHP is a nonpartisan, nonprofit organization. Its mission is to advance policy that drives equitable access to preventive health care for women and girls. All of our work filters through the 4 pillars you see on the screen. Last year, AWHP launched Everybody Covered, a campaign working to ensure that everyone has access to evidence-based obesity care, just like any other chronic disease. Through this campaign, we proudly collaborate with 20 incredible patient and provider organizations, including Diabetes Sisters, to drive meaningful change. What makes the Everybody Covered campaign so special is the way it empowers women to take action. We're not just raising awareness, we're equipping women with the knowledge and confidence to advocate for obesity care coverage. We're making sure employers and policymakers understand that obesity isn't a lifestyle issue. It's a chronic disease that deserves the same level of care and coverage as any other health condition. By sparking conversations and inspiring change, we're shifting the narrative and driving real change. But what truly sets the campaign apart is the way we activate women as advocates. We provide the tools and resources they need to have meaningful discussions with their employers and their policymakers, ensuring that comprehensive obesity care becomes a priority. This campaign isn't just about people, about policy, it's about people, it's about women. At AWHP, we know that obesity is a chronic disease and a woman's health issue, affecting over a third of women in the country and disproportionately impacting women of color. It is associated with over 200 other health conditions that impact women across the lifespan, including fertility issues, breast and ovarian cancer, depression, and more. So put it this way, if you care about maternal health, if you care about breast health, if you care about mental health, for example, then you need to care about obesity too. Obesity affects women across the lifespan and in many aspects of their lives. For instance, women living with obesity are often stigmatized by their friends, by their family members, and co-workers just because of their disease. Financially, diseases caused by overweight and obesity cost our nation's healthcare system a collective $1.72 trillion every year, equivalent to 9.3% of the US GDP. Interestingly, women bear a significant greater economic burden due to obesity, accounting for 70% of these costs. In the workplace, women affected by obesity earn as much as 12% less money than their colleagues and are less likely to be promoted. Compared with their peers, women ages 51 to 61 with moderate to severe obesity have a 40% less financial net worth. These gaps are unacceptable and demand change. To put it simply, access to coverage for obesity care can be truly life-changing for many women. For example, one woman we talked to mentioned that thanks to obesity medications, her life has improved dramatically, including in everyday moments. Now that she has coverage for obesity medication, she can walk to her daughter's softball field and play with her. These seemingly small moments are so important, and it is thanks to coverage for comprehensive obesity care that she is now able to experience them. We know that obesity care coverage is a key issue for employees. 20% of Americans say they would change jobs to gain coverage for obesity medications. What's more, 80% of American adults believe insurance companies should cover the cost of obesity medications. And of course, given that employers are one of the largest sources of health insurance in this country, they play an important role in tackling obesity. AWHP and the Everybody Covered campaign are encouraging employers to do three things. First, recognize obesity as a chronic disease with causes that include those outside of an individual's control. This includes an understanding of the ways obesity affects women and women of color disproportionately, and the impact the disease has on all aspects of employee well-being, including physical, social, and financial considerations. Second, review benefits offerings for opportunities to better support obesity care for employees and communicate coverage as a priority to benefits administrators. Comprehensive coverage for obesity care should include four pillars: medical nutritional therapy, intensive behavioral therapy, FDA-approved medications, and bariatric surgery. Third, work against weight bias at every level of a company and make sure that this is demonstrated through the company's culture. Some strategies to address weight stigma include educating employees about weight bias, using person-first inclusive language, establishing an employee resource group, and providing reasonable accommodations for employees living with obesity, like telework and sick leave policies. These three principles serve as the foundation of an open letter that the campaign sent to executives at top workplaces for women earlier this month, advocating for obesity coverage in health plans, just like any other chronic disease. The letter was endorsed by 68 organizations, including leading voices in healthcare, such as the National Alliance of Healthcare Purchaser Coalitions, the Obesity Care Advocacy Network, and DiabetesSisters. We want to ensure that women have the knowledge and resources they need to confidently advocate for the health benefits they deserve. To support this, we've created a resource outlining 5 key steps to engage with employers effectively. The resource advises that you review your insurance benefits to understand what's currently covered under your plan. Next, connect with your company's HR or benefits team to learn more about available options. Then, draft a letter to your benefits leader that clearly states your needs and requests coverage. A template letter is included in the resource. Engaging with colleagues can also help strengthen your case, as collective advocacy can have a greater impact. Finally, prepare for a follow-up conversation with tips on how to have a professional and productive discussion with your company's leadership or HR lead. By taking these steps, women can feel more empowered to advocate for the benefits they need. I'm excited to discuss further and look forward to answering any questions about the campaign or our work. But before we get to the Q&A, I want to bring a very special woman into the discussion. Shenese is a post-bariatric surgery patient and obesity advocate who now works actively as a personal fitness trainer, fighting passionately to end weight bias and change the perception of obesity. Shenese, we are so grateful for your advocacy. Please tell us about your obesity care journey.
Hi, everybody. Thank you for that wonderful introduction. My name is Shenese Colwell. I am absolutely very passionate about telling my story and helping to inspire, motivate, and educate others in this community My why, I started my bariatric journey, my weight loss journey, about a year before I was due to graduate with my master's. I was tired, physically, mentally, emotionally exhausted. I had taken care of everybody else, but hadn't taken care of myself, and I was ready to change that narrative. So I spoke to my physician about having weight loss surgery, and she was very adamantly against me having the surgery. She tried to talk me out of it. She didn't think it was a good idea. This was back in 2011. And she really did not want me to do it. So she provided other options, a nutritionist, things like that, things that I had already tried. But just to appease her, I went ahead and did those things. But in the interim, I was still doing my own research, the pros and cons of bariatric surgery, going through support, not support groups, online forums where people were talking about their experiences with bariatric surgery, things like that. So just digging around, trying to get the information for myself so that when I completed the things that she wanted me to complete, I could come back again with my own evidence and my own research and tell her. And that is exactly what I did. Again, the things that she recommended did not work for me at that time in my life. So I went back to her and I had the crucial conversation that, look, this is what I'm going to do. You know, I have a really good relationship with my doctor. A lot of people might not have that experience, but she finally got on board, and I told her, I really need you to support me with this. She signed off on all the paperwork. I had gastric bypass surgery in 2012, lost over 150 pounds, have kept off over 115. But again, doing my research, I knew what the pros and cons were, what people were struggling with in that realm of having sleeve surgery and gastric bypass surgery and things like that. So I knew what to expect. Um, so I made sure that I equipped myself because I didn't feel like I was going to get that from my physician. The sources and the resources to make sure that I was one of the people who was able to keep that weight off. Did my research, did all of the things, and put things in motion that would help me to be successful, taking accountability. Everyone might not have that drive and that um, skill set to be able to equip themselves. So I also wanted to be a resource for others that might not have that skill set. So doing all of the things, working with my doctor and getting information and continuing to research and reach out and speak to other people. I became a certified health coach, a fitness nutrition specialist, you know, to motivate myself to work out. I became a fitness instructor. So all of the things that I put in place have worked for me. And again, that might not work for everybody, but I can do my part by being a voice and being that resource for people to help motivate, to help educate, and to help inspire others by walking my walk and, you know, sharing my journey and my story, reaching out and partnering and being a part of organizations like the, you know, Diabetes Sisters and Obesity Action Coalition, uh, all of the organizations that are working hand in hand to help better policy, access to care, all of the things, because those are things that aren't easily accessible for most people. Dietitians, things like that, that people need after surgery, after the medications, after the aftercare, the things that help us sustain that healthier lifestyle. Obesity was classified as a disease in 2013, I think. I had my surgery in 2012. I did all my research in 2011 before all of these things were considered, you know, that it was a disease, that it's something that needs to be maintained. I will always struggle with obesity because my mindset and the things that triggered me, and, you know, the DNA, or the things that, for lack of a better word, the things that are generational in my family that contributed to my obesity, you know, are still there. They're still in me. There's still mental blocks and things like that that I have to overcome. So having access to all of the resources that we need to sustain and maintain need to be available. And so I'm very thankful to all of these organizations who are fighting tirelessly and putting forth so much effort and reaching out and really taking the initiative to make change so that we can overcome this disease. and help to manage it better. So I thank you for letting me use my voice and letting me share my platform of all the things that I do to kind of help my my part in this. It seems like it's small. It used to seem like it was small to me, but being able to speak to others and to be a voice for others and to let them know that there are people out there fighting for change makes me feel a lot better. So I thank you guys so much for just letting me share my story.
Thank you, Shenese. Your story is like amazing. And I think what I loved and the thing that I really picked up on is really kind of the relationship that you had with your physician. And I think that is so important and that you were so proactive and really looking for those resources. So I think that to me is everything because so many times I hear as a nurse that their physician doesn't understand or they bring up the conversation and then there's no dialogue around or no narrative about kind of like what to do and what are those next steps. And it seems like you and your physician really worked together as a team and came up with the right solutions at the right time. So
Yeah.
I think
She
that was
realized that she had to be better educated about people dealing with that issue. She realized in that moment, and we've had this conversation time and time again since my surgery. She was like, it's just not a good idea. It's not safe. I've heard it. It's not safe. She was going off of hearsay. She was going off of what she knew from other patients, maybe that had had the surgery. So she made a point to tell me that she was making an effort to be better educated so that she could help more people after seeing my journey.
and that's great. I mean, education is a two-way street, right? And what an example of that. So I just want to say thank you in closing to both of our speakers for such an inspiring discussion. We know that the work of advocacy is never done, and your work in the space is truly invaluable. So our speakers have prepared a tip sheet today for you, so it's available on the site under resources. So let's take some questions from the audience, and I do know that there is one question that, several questions, and the first question is, what if, and it's from an anonymous attendee, what if someone is self-employed? How can they advocate for better obesity coverage?
Shanice, you want to take that one?
I just say just jump in. I mean, there's no right or wrong. Just make your voice heard to the people who can make the change or help make the change. All of these organizations out, um, lots of organizations on board working hand in hand. If you reach out to one and ask, if you're not able to help me, can you connect me with an organization that can help me? There are so many more resources available now than there has ever been. And with all of these organizations working together, there's bound to be somebody out there. You just have to be very proactive and very diligent in taking that initiative to find what is going to work and find an organization or something that is going to help you along in the journey. So I wouldn't just sit on my hands and feel hopeless. Just not saying that that's what you're doing, but I'm saying some action is better than no action.
Let me tag on with that by saying I think it's important for you to have conversations with your policymakers, particularly at the congressional level and at the regulatory level. Having that conversation with your member of Congress or members of Congress that sit on the appropriate health committees at the federal level and at the state level may also be a good way to advocate for getting coverage and making sure that you can advocate for obesity care, even if you're self-employed.
Okay, very good. We have another question. So, what are the most significant policy barriers preventing access to comprehensive obesity care in the US, and how can we as advocates help address them?
Well, I'm going to jump in on this one. So we are very excited about the CMS, the Center for Medicaid and Medicare Services, has a proposed rule that would cover obesity medications for Medicare and Medicaid beneficiaries. That is now with CMS. They are looking it over, they're evaluating it. It's hopefully within the next month or so, they will be making a decision around the coverage, because it has to get back to particularly the states to make sure the states can do whatever the administration that they need to make obesity medications available for Medicaid beneficiaries. So that's one good thing. The next one is we're hoping this year that the Treat and Reduce Obesity Act will be reintroduced in the US Congress. And so we're hoping that we can get that over the line that will allow for coverage for Medicare beneficiaries and making sure that they can get the other appropriate services like medical nutrition therapy and intensive behavioral therapy. So we're hoping at least those two will get through this year.
Very good. Great. And so thinking about those services, so when you think about obesity care, there's the lifestyle piece, correct? That has to do with maybe physical activity and nutrition. And then there's also the clinical side that has to do with more of the medication therapy. And do you think that those two things are coming together a little bit? And you said services for nutrition. And I know, Shenese, you're in the exercise arena. And is those usually aren't covered benefits. So are you thinking that both will be covered in the next, in the Treat the Obesity Act, or would it be just more nutrition?
We're hoping, the obesity community is hoping that it will be covered. And I think that's one of the reasons why the Alliance for Women's Health and Prevention made a pitch in our letter to employers to cover comprehensive obesity care. We just want to make sure that everybody possible can get covered. And that's also a policy change when you look at it from the obesity community side. Policy is not just with the Congress and with the state legislatures, but it's also with the employers who again provide one of the largest sources of health coverage in this country.
Somebody, Rhea, it said, I would like to send this webinar recording to my sister. Is this available? So if your sister signs up on the Diabetes Sisters as a woman either interested or with diabetes, I'm not sure what she is, she can go and it'll be on demand. It's recorded and it will be on demand. That's a question. And then we have another question here. Many insurance plans don't cover obesity medications or treatments, which we talked about. What can be done to change this, and how could we push for better coverage at our employer, and who do we talk to? So I guess it's kind of more of that grassroots with their employee and their insurance company. So is it with the employer side or the insurance side? I think that's what the question is asking.
It's with both sides, actually. But what we're advocating for, based on our letter to employers, we want everyone to have that crucial conversation with their employers, with their HR benefits team, with their chief financial officer, with the CEO, if they can get a word in edgewise to them about making sure that comprehensive obesity care is offered in their benefits packages. Have that conversation about living with obesity, what that means for you, what that means to your family, what that means to your community, and just basically ask, can we have obesity coverage in our health benefits package? Start there. It's a simple conversation. It's a human conversation. And more importantly, it's a woman's conversation. So let's go get this done.
Very good. Very good. And this interesting question, and maybe this could be something Shenese could shed some light on. It says, how can healthcare providers and patient organizations work together to ensure that women receive obesity care without stigma? So we know that there's a lot of work, and Diabetes Sisters will be doing a program related to stigma in May, but this all ties in with obesity. And so thinking in terms of that, I think it might be very sensitive for some women because of the stigma that's been attached to it. So any thoughts from either of you on that question?
I think we need to just start using our voices. We have to advocate for ourselves. If we continue to be pushed in the background and unheard and unseen, and our voices aren't really important, they're muffled or muzzled or whatever you want to call it, they're suppressed. We need to speak a little bit louder, be a little bit more adamant about the care that we deserve because no one's suffering but us. If we continue to stay quiet, one voice can make a difference. And there's so many voices out there that feel like they are siloed and they aren't. Look at all of these women out here working so diligently to make change and to make things happen. And they are happening. But again, as Millicent said, there's more work to be done. There's so much more work to be done. There are changes, there are advances, but there's still a long way to go. So I would say you just speak a little louder, scream, do whatever you have to do, speak a little louder, be a little bit bolder about what you deserve. It's your body, it's what you have to do for yourself. Women, we run the world. We are holding everything up. So we have to pour into that cup that is quickly emptying out because we're taking care of so many other people. Continue to pour into your own cup. Speak louder. Be a little bit bolder about what your needs are.
Both Diabetes Sisters and the Everybody Covered campaign have a platform for you to tell your story. We want you to tell your stories at both of our websites. You may go to both and talk to your sisters, talk to the employers, talk to the policymakers about why it is important to have comprehensive obesity care. You can talk to them about body shaming. You can talk to them about the financial implications. You can talk to them just like that lady did about her being able to go on that softball field with her daughter and being able to play softball with her daughter. That's an important part of life. And so let's tell the stories and how getting this obesity care and treatment will make a difference to our families and our communities.
Thank you. And I know the power of storytelling. So that's really, really a great suggestion from the two of you. And there is opportunity, Diabetes Sisters, please share your story. And also I know on the website for the Alliance, is that the website, Millicent, to write?
Well, the Everybody Covered.
Everybody Covered. Okay,
perfect. Yes.
Perfect. Great. And this is an interesting question, and it comes from an anonymous sender, but it says, how can we engage in media in changing the narrative around obesity care and ensuring it is recognized as a health priority? And it's interesting because there are a lot of bloggers in the diabetes community and people that are really instrumental in messaging. So I think, maybe they haven't really thought too much about the advocacy end of it. So that might be a good something to provide some insights into.
There is an organization.
The Alliance for Women.
Sorry.
Go ahead, Shenese.
There is an organization called Healthy Voices that really helped me to find my advocacy voice. I didn't realize it was an advocacy, my whole messaging was advocacy until I came across Healthy Voices, and they kind of helped me. There are people in that organization that advocates everything from breast cancer to diabetes to everything, obesity, what am I trying to say? Ending obesity bias, just tons of different diseases and things like that. There are tons of people in there. So I would say that would also be a great resource if you're wanting to find your voice as an advocate, or find other advocates that maybe can relate to what you're trying to do or what you're looking for.
Okay.
What I'm going to ask is that you will make sure you go on LinkedIn and Instagram and X. I want you to tag on to our platforms, share, like, send on to other people that might need that information. And every time you decide you're going to put something out there about your walk, your run, you're having a great conversation with your healthcare provider, put that out there. Tag some people, tag some organizations, and get your message out there about your obesity journey and how others are helping you to get where you want to go, including the Diabetes Sisters, the Alliance for Women's Health and Prevention, and Everybody Covered campaign, and Shenese Colwell.
Yeah, absolutely. Great suggestions. And I love the comment about Healthy Voices. Is Healthy Voices part of the Everybody Covered campaign? Are they one of the organizations as well?
I would hope so. If not, I can reach out and see if I can encourage them because, again,
Yeah.
there's power in numbers.
Absolutely. And question two that I'm just thinking of, is there training to be a healthy voice? Because I do think that sometimes people are afraid to speak up, right? So is there training a resource for training that could be helpful for our members here?
That's a great question. I know they offer lots of resources, grants, and things like that for people
Mhm.
who have projects and things that they want to get out to amplify the voice in their advocacy community. They have lots of really great offerings. They have a conference every year, really great conference where all of the advocates come together and share their struggles and success stories and things like that. So that's an interesting question.
Another question from an anonymous attendee, and I'm just reading it. I have a friend on Medicare and she can't even get them to pay for a nutritionist or a dietitian because she doesn't have diabetes. Weight loss meds are cost prohibitive for her. Is anything in the works for changing the Medicare rule around this and across the weight loss meds? Millicent.
Sure, I think she needs to go back to her healthcare provider because now through Medicare, you can get obesity medications for diabetes. You can get medications for cardiovascular health. The major issue that we're most concerned about in the obesity community is getting the obesity medications for obesity, which is a chronic disease.
Right.
So she just needs to go back to her healthcare provider and advocate for herself that Medicare now does cover that.
Yes. So just to clarify here, so Medicare would cover the medications because obesity is considered a chronic disease. And is that something that she needs to articulate or narrative? Because it says she doesn't have diabetes. So I'm just wanting to make sure that she gets the right message here.
Right. If she does not have diabetes, Medicare will not cover for obesity. That's what we're fighting for.
Okay.
That's what we're
Okay.
advocating for.
Okay, so stay tuned, whoever sent that in. They're fighting for that person who doesn't have diabetes and has obesity to get those medications covered. Next question comes from an anonymous attendee. What person first language does the obesity community prefer? For example, those of us with diabetes prefer person with diabetes or person living with diabetes as opposed to diabetic. So is there one in the obesity language?
Yeah, it's pretty much the same. It's people first language. So not the disease, but the people first. A person living with obesity, for example.
Beautiful. Great question. Yes. And then another question, do you give trainings on storytelling? Like how to tell your story?
That's something that we certainly can offer.
Very good. Okay.
I say be you, be authentic. Tell your story in a way that resonates with you. Don't try to script it. Just it comes across better when it's authentically your voice.
Very good. Very good. Okay, we've had some great questions. I think just in closing, just to summarize briefly from our speakers, kind of what are the key takeaways from today's discussion and what actions can our members and the people on this call take immediately to support better obesity care? So if you can just kind of like do a quick wrap up on that, that'd be great.
Millicent?
Sure.
Key takeaway.
We just want to make sure that all women understand that their voice is important, that they need to share their concerns about obesity care with their employer and the policymakers. Employers, that they're making sure that for them to understand that obesity is a chronic disease, that we want to make sure that by looking at bias throughout their entire company culture, and to make sure that they review their health benefits and take a look at them to make sure that they consider obesity, comprehensive obesity care and treatment.
And Shenese, any last comments that you'd like to share?
Just start with your research, start with advocating for yourself, and then along the way, as people see you trying to make a change and be a change, the ball starts rolling. That's what I've noticed for myself. The ball will start rolling. Again, there's still a long way to go with the aftercare after you've taken the medication, after you've had the surgery, all of those things, fighting to have coverage so that you can maintain that weight loss, but just start.
Very good. Love the message. A journey of 1,000,000 miles starts with the first step. So that's so true. And
it is an ongoing journey. It doesn't stop. It's ongoing.
Yeah. And you've been a great example of that. So we're about out of time. So I just want to really give a big thank you to our incredible speakers, Millicent Gorham and Shenese Colwell, for sharing their expertise and their passion for diabetes care and advocacy. And of course, a huge thanks to Eli Lilly for sponsoring this vital weight management webinar series. So what's next at Diabetes Sisters? Let's take a look at some upcoming events you might want to miss. So now Millicent will be back along with Michelle Neely, who's the Vice President of the Alliance, on March 26th and March 19th. And they're going to be doing a hands-on workshop. So join this workshop because you'll be given some really good tips. It's going to be a discussion. It's going to be a time where you can share your stories. Some of the things that we mentioned today about using your voice and how to use your voice will all be part of that workshop. So go ahead and join us. It's on the 19th at noon Eastern and March 26th at 7 p.m. Eastern. And you need to register for these workshops through our website. And remember, it's just an excellent opportunity to really get the nitty-gritty, ask questions, and really get answers from these experts. On March 20th and March 27th, we're continuing on our type 1 diabetes screening and prevention workshops with Dr. Victoria Buhari, who's a board-certified endocrinologist. And these webinars will cover the why, the how, and the what of type 1 diabetes screening. And it's really part of our ongoing efforts to increase the awareness and to really know that we can delay the onset of type 1 diabetes. And then on March 25th at 7 p.m., we're continuing our prevention type 2 diabetes workshop. So if your loved one or you are at risk for diabetes or you've been diagnosed with prediabetes, please join. It's at 7 p.m. March 25th, and we have a really great expert leading those discussions. To sign up today, you have to register on our website. Remember, it's quick and easy. If you're not a member of Diabetes Sisters, we encourage you to join to take advantage of so many of our great programs, resources, and support findings. Today's webinar was recorded, and it will be available on demand on our website in the coming days. So be sure to check back if you'd like to revisit any part of the discussion or share it with your family and friends. So thank you all for joining us today. We look forward to seeing you at our next event. Have a wonderful day. Bye-bye.